Hey guys, so we are going to inject, in this case we have Botox Cosmetic, and we're going to inject glabellar region on this patient. So let's begin. Her face is completely prepped already, so we cleaned it, we used alcohol, and that's what you want to do obviously with all your patients. You want to prep them, but we wanted to skip over that step right now just for it to make this a little quicker. So we're going to start with, and there's no particular order, so it doesn't matter if you start with injecting in the procerus muscle. We went over the different muscles of the glabellar region. You've got your procerus, your depressor supercilii. If you're having the marks on the face, wipe them off. That's really just for instructional purposes, and especially if you have the marks, you never want to go through that because you could create that tattooing effect. Okay, so right now we're going to start right over here. This is the corrugator muscle, all right? Remember, one thing important about the corrugator muscle is that you're going to do the pinch technique. So you're going to pinch the muscle. Your thumb is going to be on the lower part of the orbit. The reason why that's important is because you're going to block, or you're going to eliminate the possibility, hopefully it's going to completely eliminate the possibility of the product to diffuse down into the eyelid and into around the eyeball and so forth, all right? That's a potential complication. But if you hold it correctly and you pinch it like this, and you also give the patient correct instructions, which we'll go over. Essentially, don't touch the area, be very careful, and limit your activities and exercise and so forth. If you do all those things, then the likelihood, the risk of any sort of side effect like with a eyelid ptosis is very, very unlikely. Okay, so you want to do this kind of quick and just go straight in. So I don't know if you could see my hand too closely, but what I'm doing here is so again, pinch technique, I'm squeezing over here like this, and my other hand is being rested, my pinky is being rested right on top of my thumb, and that is, I could almost close my eyes here, which don't worry, I'm not going to do that. All right, and we're going to inject 2 units, that's all. 2 units right here, and right next to it, another 2 units, right into this muscle. This is the glabellar muscle. So, hopefully you guys were able to see that okay. All right, so we got the corrugator on this side, and now we're going to do the corrugator on the other side. Okay, so again, we're holding. I'm actually going to come around. I'm going to try something a little different. I'm going to come around. If I were just doing this face-to-face with the person, I would come in like this. I would pinch that muscle, that corrugator muscle, again with the thumb on the lower orbital rim to block any potential of the medicine to diffuse down. But in this time, another way to do it is just like this. So look what I'm doing here. Now I have my forefinger, again, on the bottom of the orbit, right, and I'm just pushing it up like that, and I'm using my thumb to grab the muscle in the same way. So now I'm going to go right in here, okay, 2 units here, okay, and again on the other side, again right next to it. Okay, now I'm doing a little bit more on her because we really want to make sure that we're covering the whole thing. So if you remember what we talked about earlier, so Andre, if you could tighten up again like that. So remember, we want to get the edge of the corrugator muscle. So we want to get the whole muscle. So now I'm going to come in right over here, and I'm just going to inject that part of the muscle too. 2 units there, and the same thing on this side here. Okay, good. Okay, perfect. Okay, so that was the corrugator. Some pearls again with the corrugator. I know I said this earlier. In case you missed that part, let me just reiterate a little bit right now. What's important about the corrugator is you want to inject directly into the belly of the muscle, but you don't want to go too deep. If you go too deep, potentially you could catch some of the fibers from the frontalis that come down. The frontalis inserts right into that area, all right? So if you catch that, you're going to drop the whole, the frontalis is going to be lowered in that area. So we want to be very, very careful. Okay, now we're going to inject right into the procerus. So again, pinch technique, all right? And you're just injecting right into that muscle, okay? We could do 4 units in that area. And that's it. So we just got that whole area there. Okay, pearls with injecting into the procerus. It's pretty straightforward. Again, you want to make sure it's pinch technique, you're injecting directly into the muscle, and that's it. Patient instructions, you're going to tell the patient again to limit activity, and I'm very, very particular about this. I tell them to make sure that you don't touch your eyes, don't press around, don't squeeze it, don't touch it, because the idea is you don't want any of that medicine to diffuse anywhere except for where you injected it. Okay, so that's it. Now we're going to do lateral cantharides. So now we're going to inject lateral cantharides. These are the crow's feet, okay? A great technique that I like to do is I like to stand on the opposite side of the person, the patient, all right? And I put my index finger right on the corner of the orbit, and the purpose of that is it protects the orbit, it protects the eye, all right? And the other nice thing about it is when you pull the skin in nice and taut like that, see how nice and taut the skin is? When you advance the needle, it's going to penetrate more easily, as opposed to if the skin was loose, it would kind of be dragging the skin, the needle through the skin, and it would definitely hurt a lot more. So that's one advantage by putting your finger at the corner of the orbital rim and pulling back. And the other advantage is that you want to make sure that this medicine is not going to diffuse anywhere where it's not supposed to be. So if you're pointing towards that area and a little bit of the product diffuses into the eye, into the eyeball, what could happen, right? We talked about this earlier. All sorts of potential side effects. It's not anything that happens commonly at all, but it's still something that potentially can happen. You have now a neurotoxin inside the eye. Well, it could weaken the eyeball muscle. So now the person could have diplopia. They could have strabismus. They could have all sorts of unusual side effects like that. Again, it's something that's pretty unusual, but why not just have very, very good technique and make sure that there's not even a potential for that to happen. The other thing we talked about earlier is the technique. Okay, so try to watch what I'm doing here. I'm holding the eye like this, orbital rim, and now I'm connecting my fingers like this, right? And I'm also leaning on the person's head. And when you're at the seminars, when you're here during the workshops and you're practicing, practice this, practice other methods. The idea is you want your hands, you want that syringe to be coming in very, very, very stable. You don't want to be shaky. So if you're about to do a technique and you see that your hand's shaky, change your method. You know, do it a different way. Brace your hand, brace your fingers, do something. But this is a very good technique I've used for many years. I did it when I did a lot of pain management injections. So take a look at this. We're going to inject now 2 units right here. Very, very simple. 2 units here. We're going to inject right next to it, 2 units. And look how nice and easy that penetrates through the skin because I pushed that back. I pulled the skin taut. Okay, so we don't need to do more on her, but again, we want to be really, really careful. Let me just show you with this marker. So you want to be really, really careful not to come down too far, all right? Because again, we talked about those muscles here. Below the zygomatic arch, what do you have? You have the zygomatic major and the zygomatic minor muscle. You don't want to inject in there. You have all sorts of different structures as you're coming around into the front. You don't want to inject into this levator muscle, okay, that connects to the lip. So you want to keep your injections right out to the side. We talk about in more advanced courses how to do other techniques around the eye, but for this level 1 course, this is more than sufficient to go over and learn what we're doing right here. Okay, so that's that. We're going to do the other side right now. Let me see, before I do that, let me just make sure there's anything else that we can do in this area. If you could see, she doesn't really have many lines up here, so I'm going to have another patient to do frontal lines. But if you could, Marjorie, if you could raise your eyebrow. Yeah, okay, good. You could see there's really nothing there, so we're going to use another patient for that. So I'm going to come around this side, and I'm going to do the other side. Okay, guys, we're going to do the other side. I just had to take out a little bit of an air bubble, and we're good. So we're doing the other side, lateral cantharides. Actually, you might be able to see my technique a little bit better here. See how I'm connecting my hands like that? And that's it. So like this, I can really manipulate this needle anywhere. When I release like that, and I come in, my hand is potentially could be very shaky. But the minute I connect like this, it's extremely, extremely precise. So it's a great technique. And again, don't forget, look where I'm standing. I'm on the opposite side of this patient. Okay, I'm on the opposite side of the area that I'm going to inject. So this is her left eye. I'm standing on her right side. Okay, so we would do the opposite on the other side too.